Welcome, everyone. Thank you for joining us today. I'm Teresa Marantat, CEO and Chief Nursing Officer of the Windsor Essex County Health Unit. For areas in the region that are moving to Stage 2, it is important that appropriate precautions are taken when reopening your business. Visit our website for the Safe Return to Business Toolkit. Review checklists for reopening your various sectors, common FAQs, and to access downloadable resources and signs for your businesses. The Health Unit is also here to answer your questions. Please email us to ask questions or identify resources you might need through our website. We will continue to work through your local BIAs and chambers to update resources to meet your needs. I will now share the most current counts. There are 102,242 people confirmed cases of COVID-19 in Canada and 34,016 cases in Ontario. Chatham-Kent has 157 cases, and Sarnia-Lambton has reported 285 cases. Michigan now has 61,953 cases, with 11,468 cases being in Detroit. Today, we are reporting 1,369 cases of COVID-19 in our community, an increase of 4 cases from yesterday. 1 person works in the agri-farm sector, and 3 people are community. 810 cases have now resolved. 480 people are self-isolating. 22% of our cases are between the ages of 20 and 29 years, and 21% are between the ages of 30 and 39 years. 58% are male, and 41% are female, with 1% unknown at this time. Our community has lost a total of 68 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There is 1 long-term care home experiencing a COVID-19 outbreak. There are currently 6 workplaces in the agriculture sector experiencing a COVID-19 outbreak. Symptoms of COVID-19 range from respiratory or flu-like symptoms to severe symptoms. Some common symptoms include a fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain, or if you are feeling confused or losing consciousness. Please be reminded that Windsor Essex has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital OLAT Campus. SOHAC, the Southwest Ontario Aboriginal Health Access Centre in Windsor, also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for his updates.
Good morning, everyone. Thank you for joining us. Yesterday, the Ontario government announced that Windsor Essex would move to Stage 2. We have been working closely with the Ministry of Health and other provincial ministries, as well as the federal government, throughout this pandemic to share our experience, our expertise, and our local data. In the last few weeks, Teresa and I had many conversations with the ministry on provincial reopening strategy. Even yesterday, we were part of a number of discussions with the province prior to this announcement. While this is a happy news for most of our region, it still leaves behind 2 municipalities, Leamington and Kingsville, whose leadership have worked day in and day out to discuss the issues related to COVID-19 in the agricultural sector. As we have done since the beginning of this pandemic, the WECHU will continue to work with the farms, the long-term care homes, the workers, health partners, municipal partners, regional and provincial leadership to contain and stop the spread of COVID-19. Similar to long-term care home and retirement homes, our inspectors, nurses, management team, and leadership are working daily to move these workplaces out of outbreak and have successfully done so through hard work and cooperation. As a region, we will need proper access to isolation beyond what currently exists, so those identified with symptoms can recover in a safe manner. This includes ensuring culturally appropriate medical supports that are available when needed, access to a telephone for follow-up, and proper nutrition of these individuals. Yesterday, the province also released guidelines for targeted testing among farms in Ontario, which can be found at ontario.ca. This site describes the continued mass testing of asymptomatic farm workers led by Ontario Health and the role of public health unit in outbreak management. When more than one person tests positive for COVID-19 at any given farm, the local public health, through investigation, will determine if these cases are linked through workplace transmission and will declare an outbreak. Our local public health unit, under my guidance, will give direction on isolation or work-home self-isolation. Under this new guidance from the ministry, a worker who is asymptomatic and positive may be able to continue to work under work-home self-isolation. Work-home self-isolation means an individual goes to work wearing a surgical mask and any other personal protective equipment, and the work activities must be kept to activities that keep the worker separate from others. Other than seeking medical attention, an individual under work-home self-isolation must not go anywhere else. Any decision in the case of an outbreak must be made by myself as the medical officer of health. Farm owners need to create a plan that addresses any and all public health concerns. Cases in the agricultural sector have a high number of contacts given the close nature of their work and living conditions. It varies from farm to farm and is very complex, requires a very complex public health investigation and situation that requires discussion through farm owners, through our team, through contact and case investigation, interviews, and problem solving. As of midnight, there are many additional businesses and services that are now open. Today, personal care services such as day spas, barbers, and salons can reopen. Personal services can reopen such as shoe repair, restaurants and bars can expand to outdoor dining, shopping malls and shopping centers can reopen along with tour and guide services, photography, film, and TV. Also, just as we embark on the heat of the summer, all indoor and outdoor swimming pools and outdoor splash pads can reopen under specific COVID guidance, and additional outdoor recreational facilities and activities that enable physical distancing will be allowed, as well as drive-in theaters, libraries, and community centers. For a full and complete list of what is currently open under Stage 2, visit our website guidelines and restrictions page on the provincial website for Stage 2. It is still very important that we continue to take appropriate precautions and follow the guidance of public health as more businesses open and we engage in more activity and contact with others in the public. It is now more than ever that we must maintain physical distancing of 2 meters from each other, wash your hands regularly with soap and water or alcohol-based hand sanitizer, practice good respiratory etiquette by covering your face when you cough or sneeze, limit gathering to no more than 10 people, continue to work remotely if that is an option. Wear a face covering in public when physical distancing cannot be maintained, and wear a face covering always in a commercial setting as per the order, and most importantly, stay home when you're sick. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with the Windsor Star.
Yes, Doctor. How are the health units? How's the work of the health unit changing as we move into Stage 2? Where are the efforts being focused now?
So as we have mentioned, that there are these active outbreaks happening in the farm that we are actively supporting, and as we highlighted some of the challenges with working with these workplaces, there are a number of contacts, there are a number of cases, there are a number of logistical challenges when we're talking about cohorting. There are a number of things that we need to do. So we are having this conversation daily with the farms, with our team, with all the other relevant stakeholders to ensure that we provide that support. Moving forward to Stage 2, we have done some pre-work, which was already shared with the Windsor Essex Chamber of Commerce. We have got some toolkits that are already available on our website to assist all these small businesses when they're opening up, and all these guidelines. Right now, our team is heavily responding to all the calls and questions from all the business owners, the general public, and with regards to a Stage 2 reopening, and all of that work is going on right now.
And you've been speaking for a number of days now about how it's necessary for community partners to come forward to provide more housing for workers who need to self-isolate. Have people step forward? What are we seeing on that front?
So there are a number of partners that are working on it. From our side, we have made a few connections through our Ministry of Health to support with that initiative, and all of that work is happening right now. And public health is, I guess, we're focused more on our typical role of case and contact management, but we are always available to provide all kind of support that they need. But having said that, I'm aware that the team is taking this on and working on a strategy for the isolation, basically identifying a place and set it up for isolation. And also with the new changes in some of these guidelines, there will be more conversation when it comes to work-home self-isolation and what it means and how we will put it forward.
Thank you.
Any questions from CTV?
Yeah, good morning, Doc. How are you today?
I'm doing very well, Bob.
Awesome. Good to see you again. There was an expectation on Monday that the numbers could go up in the agri-farm community based on the on testing. So I'm just wondering, because the number is really low again today. That's the second day in a row. So how far along is the testing in the agri-farm community?
So there has been a number of progress that has been made with respect to testing. And the initiatives, when it started, obviously Public Health was testing all these farms right from the beginning. And as part of our case and contact investigation, our team were out in each of these farms and each of these bunkhouses when we had a case. And then it shifted towards more on having that assessment center in Leamington. But now there has been more conversation in terms of using other agencies to support testing on site. So some of that is currently being operationalized, and the testing is continuing. We will see some of those numbers in the next couple of days or so. So we will be working closely with all of them to ensure that we are preventing and limiting the spread of the disease in each of these farms. Looking at the numbers that we had from the beginning, we had a higher number of farms with active cases. That has gone down to 6 now with 2 or more cases. We're hoping that as we continue to do the work of public health and case and contact management and outbreak investigation, we will be able to immediately act and do all of this that is necessary from a public health perspective to contain it. But as I was answering to Taylor in my last question, is we do need support from all the other sectors to identify the issues that are beyond public health and to support that from a community support perspective, health system partners perspective, to help contain the outbreak in the best possible way.
I guess that brings me to this one because, there could be a fear from, the surrounding communities that migrant workers may go shopping in like Essex or come to Windsor or whatever. So are there contingency plans, I guess, to isolate them and make sure that, the spread doesn't happen?
Well, we have to recognize that, we cannot stop the people from crossing any of the municipal borders, and even the restrictions on crossing from Windsor Essex to Chatham-Kent or any other place. So that is not practical. I think what the focus is on individuals who are identified as a case or individuals who are identified as a close contact, and both these groups need to be self-isolated, period. And then all the efforts that we need to put them to continue to keep them in self-isolation, that is the focus, and that is something that we will be actively working with the farm owners to ensure that this is happening. And again, looking at the community support, community partners, to ensure that they have all the tools and everything that they need to make sure that individuals who need to be self-isolated, they are self-isolating.
Wonderful. Hey, can I get one more in?
Sure.
Just curious, there's a lot of opening today. You rattled off a pretty good list there today. So will the health unit be out and about at some point, just kind of overseeing the reopening of, everything?
So our inspectors, and Teresa can maybe add in, our inspectors typically go out on complaints. And if we're receiving any of those complaints, we do follow up on those complaints. Right now, the team is really focusing on providing all the tools and education that all of these businesses need to support them with a safer reopening. So that's where our inspectors are focused on, including all our health promotional staff that are developing all these resources, our communication team that are trying to answer all the questions that all these businesses have. So our team, outside of those who are not doing the case and contact management, are really focused on supporting everyone in the community. So that work is ongoing, but if we receive any complaints, any concerns, our inspectors will be following up on it. I don't know if Teresa wants to add something.
And we have a group out today as well with the Ministry of Labor and PHAC, and also Service Canada for the inspections at the bunkhouses, which are continuing today.
Good to know. All right. Thanks, guys. Appreciate it.
Any questions from CBC?
Yes, good morning. Dr. Ahmed, in other regions, when they entered stage 2, medical officers of health have taken a bit of a harder line. For example, in Chatham-Kent, they decided not to open splash pads. I'm wondering if you have any recommendations or have taken a harder line on any of the rules outlining the stage 2 reopening.
So all of those measures we will continue to identify with respect to the actual spread of the disease. So as we are talking about more and more businesses opening, there will be a focus more on the outbreaks or cases that could be linked to any of these workplaces or new businesses that are opening up. We will also be actively looking at potential sources of where these infections are coming from. There are a number of other regions that have allowed splash pads to open for several reasons. And again, depending on the day and depending on what we are looking for. Splash pads are outdoor. Splash pads, there are definitely, if you have good sunlight, there's obviously an ultraviolet rays that are helping with some of these quote-unquote disinfection that could possibly happen. And having said that, I think we still want to make sure that people are maintaining their physical distancing, and if people are staying home when they're sick. But there are other activities that we need to look for. Everyone in Windsor and Essex have been following all the recommendations from public health, maintaining all their physical distancing, doing their part. So I think it's time that we have to look at the real risks and then try to contain that risk as best as possible based on the evidence.
Thank you. And just to follow up on what Teresa was saying about the inspections of the bunkhouses, how many are being looked at right now?
The joint inspections, I believe they have probably 4 or 5 they're doing over the next couple days. But overall, our health inspectors have probably inspected close to 800 bunkhouse inspections this year so far, outside of this, joint inspection initiative.
And the joint inspection initiative, I just missed that. It was the Ministry of Labor, PHAC, and who was the federal agency?
Service Canada is also involved.
Thank you.
Yeah, and just to add that our inspectors have already been involved in these inspections right from the beginning every year. So this is more of a joint inspection opportunity that we are participating. Our inspectors have always been involved in all of the complaints and the inspection of these bunkhouses for a number of years now.
And I'm just wondering, health unit inspectors have went before the pandemic began, and obviously there wasn't as much cause for concern there. So why such a discrepancy between, the concern for the accommodations now versus before COVID happened?
So I think that's if I can say, it's not accurate. The concerns about these accommodations have always been there. We have raised it, but based on what the current legislative framework, regulations, and requirements, they meet all of those standards. I think those standards need to be looked at. We have already dealt with a number of outbreaks in these facilities, and accommodation, their living quarters, their working conditions have always contributed to the spread of the infectious disease. So it's nothing that we were not, we wouldn't say that it was not a concern. It was a concern, and that's why the focus on when COVID started was more on the education and prevention side, recognizing that in the short-term period, we're talking about 8,000 to 10,000 people housing accommodation. It's practically impossible to change that in such a short period of time. What we can do from a public health role perspective is obviously to prevent and have all those information, health promotional activities, working with the partners to have all the good systems and policies in place to prevent it. And it obviously, housing is not something that public health can provide, and public health can obviously advocating for it for some time, and we will continue to do that. And that's why it's a welcome initiative to have the engagement with the provincial government and also with the federal government to talk about short-term solution, which we are doing right now, and then we talk about the long-term solutions, that what we need to do moving forward to have these problems addressed for a better good for everyone, for our region, for these workers, and everyone involved.
And just to add to that, our inspections in the past continue to be coordinated with the municipalities because there are also fire regulations and building codes. So public health has their role, and we follow guidance and specific prescriptive guidelines. And but the municipalities of Leamington and Kingsville have been involved as well.
Thank you. And Teresa, if you could just clarify, the 800 inspections you've had so far, would that be on a yearly basis or 800, altogether throughout when the farms start up?
So there are requirements. Anytime new workers are coming to the farm, they have to have the bunkhouse inspected. So that's part of the overall ongoing inspections that our inspectors continue to do. And there are regulations that require them to go in and inspect the bunkhouses. So every time there's a new group of workers coming, they have to look at the accommodations and make sure they meet the guidelines. So that is ongoing. But since the beginning of the year, they have about 800 inspections they've completed.
Thank you so much.
Any questions from AM 800?
Yes, good morning. I was just wondering if the health unit was investigating a possible outbreak at a Kingsville grocery store.
Everything that's coming to us, let me just put it this way. Obviously, if we have a case, if we are investigating anyone that is linked to a workplace, we do look at all the possibilities of cases that are linked to that specific workplace. And so far, I have not seen any cases linked to any grocery stores or anything that we can identify or as a risk to the community or as a cause of spread in the community. And if that happens, just like we promised, if there's a risk to the public, we will be definitely sharing that information. But as of this morning, to my knowledge, we haven't made that connection yet.
Okay, thank you. This morning on our station on AM 800, David Mouche from Windsor Regional said that their organization is working with the health unit to have the hospital included on the list of places where a face covering will be mandatory. He said he was kind of disappointed that the hospital wasn't included because they do have their own policy, but of course the health unit guidelines is what everybody's paying attention to right now. So I don't know, to me, like all healthcare settings, it would be a no-brainer for a face covering to be mandatory. So are you working with the hospital, and will you be including Windsor Regional on your list of places where a face covering will be mandatory?
So I haven't been approached by anyone on this particular topic yet. From what our health unit work on and what our, if you want to say, quote-unquote, jurisdiction, restaurants, all these commercial establishments, many of these, it requires some inspection and some guidelines that public health actively monitors and follows up. So that's where we are using that to guide them and to provide them directions. Some of these organizations, such as hospitals, they have more strict requirements based on their occupational health and safety assessment, their own regulatory bodies, and their own policies, so that public health typically do not intervene unless there is an ongoing risk to the public from those facilities. So I would say that's one of those, some of those reasons that that was not included in the list. And just like you mentioned, the hospitals and the other institutions, they have the authority to make those policies and rules available. We'll continue to work with anyone who needs our support. But having said that, the locations and the premises, the commercial establishment that we have identified, there is a public health role already identified, so that's why the policy was directed at them.
Okay. Can you just confirm in Windsor Essex how many workers in the agri-farm sector have tested positive at this point?
Overall,
yes, to date.
I mean, this isn't entirely accurate, but I would say about 470.
Okay. Do you know how many different farms or workplaces that's at?
As of a few days ago, it was about over 27 farms since the beginning, since March 31st was our first case on a farm.
Okay, so since March 31st in Windsor Essex, there's about 470 workers at over 27 farms.
Yes, that's pretty accurate.
Okay, thank you.
Any questions from Windsorite?
Dr. Ahmed, over the past days to weeks, you have said that a regional approach to reopening was less than ideal. At this point, how concerned are you that people from Leamington or Kingsville may come to the other areas that are open to use some of those services that are open? How concerned from a spread perspective are you?
Well, obviously, even when more businesses are opening, there is a more potential for people to come in close contact with each other. There's more potential that people will be being more relaxed in how they are behaving in the community and these establishments. So it will continue to be a concern. Having said that, specifically on these two locations, when we're looking and at the cases where these cases are mainly in the agri-farm workers, and that's where I think we are focusing right now, especially the cases and the contacts from these sector. They need to be doing work-home self-isolation if possible, or if they're only allowed to just stay home, they have to stay home. Even from the community spread perspective in Leamington and Kingsville, I think the community spread is not that high to be of a concern, but we will be looking very closely at all of these measures as we continue to move on stage 2, not only in Leamington and Kingsville, but everywhere else. And we'll continue to revisit the data. We'll continue to make that assessment of what is happening locally, what is happening in each of the municipalities, and what more can be done or what needs to be done to continue to keep our communities safe and protected and reduce the transmission. So to answer your question, yes, it would be something that will be high on our radar, and we will be encouraging everyone who is visiting any of these establishments, whether from Kingsville or Leamington or from anywhere else. We have to be on guard. We have to follow all the public health recommendations to keep us safe, to keep us in stage 2, and potentially take us to stage 3.
Given that, as you say, the community spread is fairly low in Kingsville and Leamington, do you think that it makes sense that they are not in phase 2?
Well, I guess there's always some pros and cons and risks and benefit when we're talking about moving into stage 2 versus stage 3 or continuing to stage 1. It's all about the relative risk that we are talking about, and the relative risk to public health as well as the relative risk to economic and societal disruptions. So I think we are getting to the stage that we need to find that right balance, that where this risk lies, and what are the measures that we can put in place to ensure that we're not putting any community at a risk for even for COVID or the infectious disease spread, as well as not putting any risk for any economic and societal disruption. So we will be working closely with everyone to bring them along, to move them to stage 2 as soon as possible. We will be working with the farm owners, operators. We will be working with all the health system partners to contain the outbreak and limit the spread. I think there's been a lot of work done in the last 2 weeks or more with all these farm owners, operators, various levels of government. With all these measures in place, we will be in a better position, and we will be working hard with them, with the province, to move them along to stage 2 and moving them further, everyone of us to move to stage 3. But we need to recognize that we have to work together. We need to recognize that as a community member, we are working together for the same cause and practicing all those physical distancing, all those public health measures to support our community continue to make progress.
Any further questions from the Windsor Star?
No, thank you.
CTV?
I'm good, thanks.
BBC?
No, thank you.
AM 800?
I'm good, thanks.
Windsor 8?
No thanks.
Thank
Thank you, everyone.